Hi, my name is Dr. Mia Smith Bynum. I'm Associate Professor of Family Science at the University of Maryland in the School of Public Health. Today I'm going to be sharing my take on an article that I published with several of my colleagues, Dr. Shalonda Kelly, Dr. Jihan Jeremy Brink, and Dr. Anthony Chambers. The views that I express in this video are my own. Okay, let's get started. So the title of the article that we published that is now available online in the Journal of Family Process is called "The Black Lives Matter Movement, a Call to Action for Couple and Family Therapists." Okay. I wanted to begin by talking with you first about the context in which we are working, living, and training future clinicians. Take a look at this map of several American cities. We have Washington, D.C., Baltimore, that's in my neck of the woods, Detroit, Michigan, and Chicago, Illinois. This slide contains screenshots of the racial dot map. It is based on the US 2010 census, and you can Google it and find it if you wish. We are living, training, and working in a racially segregated society. One of the enduring legacies of redlining, a racist federal policy in the US dating back to the 1940s. This is the context in which we are having our formative years, in which we're learning to see and deal with race, or as colorblind ideology would say, not deal with race. This leaves limited opportunities for therapists, future and current, to learn about African American clients and their families. And as a result, we have a critical mass of professionals who lack intimacy with this population. And those legacies from redlining are multiple. They affect the tax base in various communities within American cities, which in turn affects schools, housing quality, neighborhood quality, environmental risks, and also access to medical care, including psychotherapy. So when students enter our programs, they may have imbibed a lot of the stereotypes about African Americans without really having a good understanding of the history. And this limits their ability to serve African American clients and their families effectively. So in this article, we cover several issues. We approach this work from the perspective of Black family therapists who have lived, worked, and trained in the discipline, and also training current and future professionals. We apply a combination of critical race theory and Bronfenbrenner's bioecological theory to couple and family therapy. We provide a brief overview of systemic racism and its impact on clinical training. There's a good review there for folks who are needing a brush up on those issues. And we describe the application of racial socialization in context. And we also describe the issues that African American couples face in therapy. And Dr. Kelly and Dr. Chambers deal with those issues directly. Dr. Jeremy Brink and I, we're the racial socialization co-authors on this piece. So the actual outline of the article differs in a specific context, but there are three critical areas that I would summarize that we're covering here that I think are useful to students and current professionals. Content knowledge, so understanding content of African American culture, the recent research in this area, the relevant theory, knowledge of self, understanding where we have growth areas and issues where we need to grow and to examine in order to be effective trainees, effective trainers and supervisors, as well as practicing clinicians. And we also address this issue of a willingness to take risks. In the American society, we're taught to not talk about race. To talk about race is in fact to be racist. Meanwhile, in African American families, we have to know about race in order to be able to navigate a society dominated by white mainstream American norms, right? So we have to constantly talk about those issues, and yet we're entering a world where people have been taught not to. And that, again, that affects the ways that things unfold in the therapy room. And so we want to try to break down those barriers and address those taboos directly and ask those folks who are treating African American clients and their families to take some risks. So briefly, I'm going to talk a little bit about racial socialization. This is a term that's commonly referred to as the quote unquote talk in the press and in the media and media outlets. But the research term is racial socialization, and it is defined as any parenting practices that communicate ideas or beliefs about race to children. Okay. There are several challenges that African American kids growing up in the US today face. And though we're dealing with them in the Black Lives Matter, these challenges, as you might guess, have been long-standing. So these are the dilemmas. How do Black parents and those who are raising Black children help Black children develop a healthy identity in a society where ethnic minorities, and particularly African Americans, continue to be systemically devalued? How do you feel good about yourself in the face of these racist stereotypes? How do you cope with racism and discrimination, subtle and overt? And then how do you navigate those two worlds that I showed in that map on slide 2? Our very segregated society, which there's spaces that are in which African American culture set the terms of engagement, and there's spaces in which mainstream white American culture sets the terms of engagement. And so kids have to be able to negotiate both, often because in mainstream institutions, that's where the resources are. That's where the wealth, so on and so forth, are also located. So kids really need to know both. They need to be grounded in African American culture because that's where the affirming positive values are. And let me give just an example. So one of the things that gets lost as we talk about the survival of Black people today, past and present and future, is that we forget how vibrant and how exciting and how resilient African American culture is. And so one of the things that you should be thinking about incorporating in therapy, if you're not already, is making sure that the Black parents that you work with and the Black children as well, that they understand that being Black is a wonderful thing. Parents can be a critical vessel for affirming this. Okay. And then there are critical lessons from the civil rights movement. So if we just look at this quote unquote status of African Americans on a wide array of metrics, from the criminal justice system to education to the wealth gap, it can be rather discouraging. And so it's really important that kids understand Black history and the civil rights movement and the inspiration and the resilience embedded in those two areas of knowledge. So for example, the Black Lives Matter movement has been going for the better part of the 2010s and into the present, but it was the murder of George Floyd, and then also what we often forget is the bird watching incident involving an African American by the name of Christian Cooper, that those events happened within a week of each other, which highlighted for the country how problematic discrimination and racism continue to be. And what we saw in the news later were worldwide protests affirming Black Lives Matter. So it's a powerful, powerful, inspirational resource Black culture is. And so it's important that kids know this history so that they can disentangle the social context and the laws and the discriminatory practices that have led to some of the current struggles that African American kids and families may have, that we have to disentangle the policies and the practices which are sourced in racism from the humanity of Black people, the creativity of Black people, the survival and the resilience of Black people. And so really making sure that kids are well versed in the fact that Black culture is highly innovative and creative and continues to shape American culture and the cultures of the world worldwide. Okay. And so the message that parents should be providing and that therapists can help support parents in providing is this idea of coming from a history of people that have overcome tremendous odds, and that you can succeed despite how others may try to define you or your possibilities. And then the last thing that I would have you take from this presentation is that this is lifelong work. Our article provides a digestible overview of the issues of the moment. It will be a useful addition to your syllabi and also a good refresher in terms of ways to think about this work as well. If you are interested, I have also conducted a workshop on how to address these issues that's available from the American Psychological Association. I just did the workshop in August 2020, and I will contact me if you want to find out more information about it. Thank you so much.